Okay, so now we are going to talk about NSAIDs. A lot of people take NSAIDs every day. Yeah, people got some pain that they got to take care of. Okay, so generally NSAIDs can be used for pain, inflammation, fever, gout, and platelet. I cannot talk. Platelet inhibition, so that they won't like coagulate together. The therapeutic effects for NSAIDs include a decrease in pain, decrease in swelling, decrease in fever, and increased ADL ability. ADL meaning activities of daily living. We're right here. You're also going to see an improvement in lab values, which includes the CBC and sedimentation rate of your patient. Adverse effects of NSAIDs include GI issues, renal failure, platelet function, rash, and tendinitis, which is the ringing in the ears. There is a black box warning for NSAIDs, meaning it's the black box warning is for cardiac pulmonary edema. There is an increased risk of myocardial infarction or stroke, and an increased risk of GI ulcers. Contraindications for NSAIDs include known allergies, bleeding risk if the patient already has a bleeding issue, known aspirin allergies, the third trimester of pregnancy, and NSAIDs should be stopped before elective surgeries. Interactions with NSAIDs include alcohol, anticoagulants, corticosteroids, and protein-bound drugs. If a patient takes alcohol, there's a risk for a GI bleed with their NSAID. With corticosteroids, they can make ulcers in the body. So there are 5 different categories of NSAIDs, and the way that I like to remember them is the little mnemonic device PACES. P for propionic acid, A for acetic acid, C for cyclooxygenase 2 inhibitors. Cyclooxygenase 2 inhibitors. Okay, I said it right. And the next one is enolic acid, and S is for salicylates. So they are the 5 different categories. PACES is what I use to help remember it. Let's start at the top, propionic acid. We know this commonly as Motrin or Advil or Aleve. Motrin and Advil or ibuprofen. Aleve is naproxen. This category of NSAIDs reversibly stops COX-1 and COX-2 enzymes, and it's primarily used for pain, fever, or inflammation. The next category is acetic acid, and the drug here is Keratolac, which is called Toradol. Here, on this little over here, this is the generic name, and those are the brand names. So generic name, brand name, generic name, brand name. That's the way it's going to work over here. So for acetic acid, this is going to block prostaglandin synthesis. It can be used for pain, chronic pain, and then it can also be used for opioid addicts who need pain relief, who cannot take opioids. The contraindication here is renal failure. Adverse effects include renal impairment, edema, and GI issues. Nursing implications is that this is for short use, meaning less days or less. The next category is cyclooxygenase 2 inhibitors. The drug here is celecoxib. Maybe I said that right. The brand name is Celebrex, so that's pretty easy. This is the only this only inhibits COX-2 enzyme. It's a second generation drug. This increases the use of prostaglandins. It's like a tongue twister. This drug can be used to decrease GI issues, osteoarthritis or OA, rheumatoid arthritis or RA, acute pain, but this drug is not to be used for fever. Adverse effect, hypertension, and lower extremity edema. It's contraindicated in patients who have a sulfa drug allergy, and a nursing implications that it can increase the likelihood or increase the risk of cardiovascular events, and patients may take this drug with food. The next category is enolic acid. The drug here is meloxicam, which the brand name is Mobic. This stops prostaglandin synthesis. It can be used for mild osteoarthritis or rheumatoid arthritis. Remember, OA and RA. It can also be used for gouty arthritis, so if a patient has joint pain. And the contraindications for this drug are similar to other NSAIDs. The last drug down here, which is very common, is salicylates, which is Acetylsalicylic, I can't ever say it, acetylsalicylic acid, which is aspirin. It's a tongue twister. This drug category blocks chemical activity of the COX enzyme. It can be used for pain, inflammation, fever, and it's also antiplatelet. So remember how over here we had platelet inhibition? That's where we get that down here. It's contraindicated in children and teens because it can cause Reye or Reyes syndrome. I think it's Reyes, but it's REYE syndrome. And the adverse effects include GI issues. So in general, for all NSAIDs, you need to know your patient's allergy, and you need to know that there is a bleeding risk involved. And yeah, ideally, I mean, your patient should experience less pain, less swelling, and less fever, and be able to do activities of daily living. So those are the drugs for NSAIDs. I'll hold it right here so you can pause it or take a screenshot. Hopefully you can read it. And remember that we're going to follow this little acronym PACES: propionic acid, acetic acid, cyclooxygenase 2 inhibitors, enolic acid, and salicylates. I think that's how you say it, to remember NSAIDs. There we go with NSAIDs. And yeah.